Florida has joined the growing list of states that are impacted by the current outbreak of measles. A high school student in Miami-Dade County became the first confirmed patient in the state. There are more than 200 confirmed measles cases, with one confirmed death throughout the country, a vast majority popping up in Texas and New Mexico. But with a heavy spring travel season about to begin, health experts are warning people to be on alert. And locally, the outbreak is causing concerns for both physicians and parents.
Beautiful, Brooke. One more, and you're finished.
Don't look at it. Don't look at it. Uh-oh. Look.
Pediatric offices like Physicians Primary Care of Florida say the measles outbreak is keeping their teams busy. From parents who want to vaccinate their kids earlier to others who just want reassurance that their child is up to date on the vaccination.
A lot of families are worried, especially the area we live in. We have an international airport beside us. With travel being so readily available, a lot of people are worried that it's going to come to our area.
Dr. David Butler says he's actually never seen a case of pediatric measles because of the effectiveness of vaccinations. Still, the pediatrician says he saw the outbreak like the current one coming based on parents' growing concerns about the safety of vaccinations. He blames that on social media.
We are seeing a lot less parents vaccinate now. There's a lot of hearsay. There's a lot of things that say don't vaccinate, don't vaccinate. And I hate to say it, but it's just a lot of bad information.
Dr. John Edwards, a chiropractor and a father who isn't vaccinating his 4 children, says a growing number of parents are taking a closer look at the data.
The CDC data says that outbreaks of measles are cyclical. You'll have them ups and downs about every few years. The CDC expects about 300 some cases every single year. And so when you look at the population of America, being around 340 million people, that's like your chance of getting measles is like 1 in a million.
Edwards says choosing not to vaccinate his children is about weighing the benefits to the potential risk.
What we're looking at is at a cascade. It's everything from the number of ultrasounds the moms have had during pregnancy, the use of Pitocin, the use of antibiotics in their first year has been correlated with neurodevelopmental disorders. And then you start throwing the shots on top of that. That's where we start getting our concerns raised up.
All done.
Edwards says he believes building a child's immune system through nutrition, exercise, and healthy living is the better way to fight illnesses like measles. It's this vaccine hesitancy that Dr. Butler blames for the current outbreak, one he's concerned about.
As far as what it could do to our community, oh, absolutely, it scares me.
25 years ago, health officials said that measles had been eliminated in the United States thanks to widespread vaccination. So what has changed? We are joined by Dr. Beth Saunders, an infectious disease specialist with Lee Health, to learn more about this current outbreak. Dr. Saunders, welcome.
Thank you. Thank you very much.
So we know this is not the first measles outbreak. What is different about this one?
Well, the difference is that we were 5 years down the road from COVID, and we have a lot of vaccine hesitancy in the United States and throughout the world. So the ability to protect everyone in our community, our herd, is lessened by the fact that there are fewer people or fewer children that have been vaccinated.
So my understanding is that the CDC says that we want, or that right now about 90% of children have received the vaccine for measles, but that number isn't high enough to prevent outbreaks like this or issues like this. Where do we want that number to be?
They like to see it around 95%. And so with that decline in the number of children who've been vaccinated and that happening year over year, we can expect those numbers to go down and that we have a greater risk for the overall population.
So since we're talking about some parents deciding not to vaccinate their children, you know, we've heard parents say that they are concerned that the risk of vaccinating their child is greater than the risk of their child getting measles.
Well, it's not. We have a very long track record of the safety of the measles vaccine. And so we know that the vaccine over years has very minimal risk, very minimal complications. But we haven't seen measles for many years in the United States. And so people have forgotten how much risk can be associated with that disease. So we can see hospitalizations, we can see pneumonias, and about 1 in 1,000 children, especially children who are under 2 who have measles, can be at risk for serious neurologic complications. And we can't predict who that's going to happen to. So that risk is there. And every year there are children who do die from the complications of measles. It can also affect the elderly or, women who are pregnant, anyone who is immune compromised. So it's not only the risk of children, but those in the adult population as well.
We've heard about supplements being, from some parents saying that I can protect my child with supplements. Your thoughts on that?
Well, supplements are intended to help boost your immune system, and your immune system is what helps fight infection. But vaccination is what we really need to do to combat measles. So vaccine helps your immune system recognize measles if it's exposed to it and prevent serious illness from measles. So while you may be able to boost how your immune system responds with supplements, it is not going to prevent you from having measles.
I remember as a kid, you just went, you got your vaccination. We were talking to the pediatrician yesterday who said, yeah, a few decades ago, you just didn't hear about parents saying, no, I don't want my child vaccinated. What do you think has changed?
Well, I think social media has changed a lot of that, and that there is a lot of misinformation out there, and it's really hard to discriminate that misinformation from actual facts. So you have to rely on going to sites that are factual, provide information. For instance, the CDC does have very good information on measles for parents.
A few days ago, we heard about, a case in Miami. What are some of the symptoms parents should be aware of? Is it an issue? Is it, something that parents need to be thinking about, looking for symptoms, or if your child's protected, you don't have to be thinking about this?
Well, it is difficult, right? Because measles and other childhood diseases can kind of mimic each other. But if your child is fully vaccinated, certainly the risk is much less, and much less worry about measles. But if children who are unvaccinated and perhaps they've had an exposure, unknown exposure, the symptoms would be that they may develop a fever, very high fever. They have runny nose, watery eyes, a cough, and then about 4 days into that illness, they may develop a rash, and that rash generally starts at the head or the hairline and goes down, and it's red raised rash, mostly not itchy. Some other childhood rashes may tend to be itchy, so this is not itchy, and your child looks sick. They look like they don't feel well and they're sick. So if you have that concern, it's best to call your pediatrician, talk about the concerns, because they may have an alternative way for you to see them in the office, right? They don't want a child who they're concerned may have measles to be in the waiting room with all the other children, because it is very contagious. And so they want to prepare and get you into their office appropriately to have your child seen. Also, local health departments are also very helpful in guiding parents on what they need to do if they feel their child may have been exposed to measles, has measles, or if they even have questions about vaccination.
If your child is vaccinated, do we know what level of protection, percentage?
Sure. If your children is vaccinated, they estimate after 2 vaccines, they're 97% protected.
Very high. If I can end on this, we tend to think of this as a childhood illness, but adults can get it. Can you tell us, I assume that's for folks who haven't been vaccinated, correct? What do you want adults to know about this illness?
Well, if adults were born in 1957 or before, it's assumed that they have natural immunity. There is kind of that gap, those gap years between the actual initiation of vaccination in the late 60s. So there may be some adults who did not have natural immunity, may have that gap. And then there is, over time, people can have waning immunity. So for instance, in healthcare systems, they monitor or they check employees to see if they have immunity to measles, right? We don't want our employees to have risk for measles or to be at risk for others. So there are certain age ranges where there may be of concern. Talk to your primary care physician about that. They may recommend that they do check a titer to see if you have good immunity. If you have no history of vaccination or natural disease, and the concern is growing regarding outbreaks, they may actually recommend vaccination. It is also people who are doing international travel and may be traveling to areas that are higher risk for disease. They may recommend vaccination for those folks as well.
Dr. Saunders, thank you so much for your time. We appreciate it.
Thank you very much. Have a great day.
Thanks for watching. We've got more great content for you, from news to the arts to the environment. So be sure to like and subscribe to WGCU's YouTube channel and follow us on our social media platforms for the stories that matter to you.